arrival in 1994 in the territory of the Democratic Republic of Congo of over 1 million refugees fleeing the genocide in neighboring Rwanda had heavy consequences on the social stability of the country. In fact, in the east, the Congolese provinces of North and South Kivu soon became the venue for clashes of all kinds.
Rebellions, foreign and national armed gangs, and women, little girls, and even little boys have been the main victims. What DRC is experiencing now is the hospitality that has been imposed to it by the international community in hosting the refugees from Rwanda, Burundi, and elsewhere. The international community has the possibility to stop this war, stop what is happening now in DRC, so that the Congolese women may enjoy development and may say one day, it's true that we have a country where we can live quietly, peacefully.
But peace means first and foremost good health care for the Congolese woman. Unfortunately, in the Democratic Republic of Congo, the crisis and the social instability have made the situation catastrophic.
La RDC paye le plus lourd tribut.
The Democratic Republic of Congo is the worst hit in terms of child and mother health care. That is due to numerous operating failures that unfortunately disrupted the social fabric of our country. Every hour, 4 women die of pregnancy, childbirth, or delivery aftermath. In addition to the 4 women who die, 30 others undergo complications related to pregnancy, sometimes traumatizing complications such as obstetric fistula. This girl arrived in Kinshasa from Bagada in the Bandundu. She has been referred to the St. Joseph Hospital in Kinshasa by a team of the Belgian NGO Médecins Sans Vacances in 2008. She was 16 years old then and suffered from a double fistula.
She was very undernourished. She was discharging urine and feces through the genital tract. We received her in very bad condition. She was almost dying, pale, undernourished. We admitted her. We began feeding her a little and we carried out a colostomy as a first intervention.
After many operations, she now feels a lot better.
I am not totally cured, but I feel much better. I am in a pleasant group where I feel very good and I have no more complexes.
Overwhelmed by a faulty healthcare system, worsened by their inability to defend their rights, protect their interests and stop the daily exploitation that they undergo, the Congolese women also had to suffer one of the most humiliating and degrading practices to human beings, rape and sexual violence. And yet,
during all these years of economic crisis, political crisis, let's not forget all those years of hard dictatorship that we had here. Women have been the mainstay for the survival of the Congolese family, the real mainstay that brings food, schooling, shelter, and a minimum of decent life within the Congolese family.
Despite their heavy responsibilities, the Congolese women have always coped stoically. Most of all, they have understood the importance and urgency of the advent of democratic institutions in their country.
As regards the democratic, transparent and reliable elections in 2006, entirely supervised by the international community, the Independent Electoral Commission statistics indicate that 63% of the real voters were women.
Apart from the situation of conflicts that has prevailed in South and North Kivu with the use of rape as a warfare weapon, violence on women has now shifted to civil life. Besides, the impunity of the perpetrators and the trivialization of the deed are major causes of that form of crime. Here in Bukavu, capital of the South Kivu province, the Council of the Women's Organizations acting in synergy, COFAS, endeavors to promote women's leadership and to accompany the women and girls that are victims of sexual abuse in their physical, mental, and legal rehabilitation and in their reintegration within their families and communities. Such an ideal has been rooted in a much less courage, the courage of a determined woman.
We have really done our best. We have even sacrificed ourselves. I myself have been shot many times, but that didn't prevent me from laying claims. That didn't prevent me from doing what I had to do to defend women's cause. And now that we have reached this moment of respite, we can be proud of ourselves because it's the result of women's claims here in the east of the country.
While facing all those trials, the Congolese women have a major partner, the United Nations Population Fund, UNFPA.
UNFPA has been our best partner so far. It's UNFPA that has pragmatically supported the women in this country. Its support has covered the government's program of women's promotion, the Ministry for Gender, Family and Children, the Women's Network. UNFPA also supports the capacity building for the Women's Network, as well as the Women and Development National Service of the Ministry. So far, it's only the support from UNFPA that enables us to lead pragmatic actions, concrete actions for women, mainly the ones that are in difficult health situations.
Among the 3,200,000 deliveries expected this year, 570,000 will be of high risk, and there are very few partners who intervene in the field. There's namely the United Nations Population Fund, but there are also the USAID group partners. The two major partners in that field cover 1/5 of the needs in terms of health zones, as our overall contributions roughly cover 107 zones out of 557, which means there is a big challenge to address in order to bring about a solution in a country where maternal mortality is described as very high by the national authorities and by the international community. We have put in place a roadmap in order to improve the new strategies and adopt the new norms related to the intensification of maternal, neonate and child mortality reduction. Here in Kaziba, 37 miles from Bukavu, people live in the mountains with very poor maternal health coverage. Pregnant women can spend days walking on rough paths to reach the hospital for care. That's why in Kaziba, the hospital has launched a strategy aimed at reducing maternal mortality. When they reach their 7th month of pregnancy, women go to the maternity waiting homes or Bignona and stay there until they deliver their babies. This young woman comes from the village of Musheni in the mountains.
I came here to avail myself of the good services of the hospital, because up there, in my village, there is no ambulance. The problem is that we are 2 in 1 bed, and when we deliver, we will not have the means to pay for the hospital charges.
Some of them sneak away in order to do some paid work, which is not advisable in their condition. But it is for their survival, because they have no nutritional support. But despite those challenges, the maternity waiting home strategy has totally changed the maternal mortality condition in the region. We've got positive results with our method, consisting in keeping the women near the hospital where they can easily get medical care. Maternal mortality has significantly decreased in the Kaziba health area, and in our 2009 reports, we have recorded only 2 cases of maternal mortality with regard to the previous years, where we used to have 10 cases or more. The United Nations Population Fund, UNFPA, has been supporting since 2004 the national program for the promotion of the Congolese woman. After having coordinated the implementation of the Joint Initiative for the Fight Against Sexual Violence and providing multi-sectorial support to victims of gender-based violence, UNFPA now spreads its action to the fight against maternal mortality. Its action is made easier by the total support of the Congolese authorities to the fight against maternal mortality. In fact, for the government, it is a strategic priority because it has included all the MDGs, including the fight against maternal mortality, in its next Strategy for Growth and Poverty Reduction document, DSCRP2. At sector level, the Ministry of Health has included among its priority objectives the fight against maternal mortality and also the repositioning of family planning, which is an important factor in the fight against maternal mortality. Walungu, South Kivu, near Bukavu. Here, the General Hospital of Walungu faces 300 deliveries per day, supports the sexual violence survivors, still with limited means. Sometimes a woman who has just given birth has to go and fetch water outside the hospital to wash herself because running water is not permanent in the hospital. As for the medical team, it is sometimes compelled to work in the dark. The advent of an ambulance provided by UNFPA and financed by the Canadian government in order to organize the advanced technologies for supporting sexual violence victims has given satisfactory results. Furthermore, with the support of the Joint Project for the Fight Against Sexual Violence, financed by Canada, UNFPA has rehabilitated the premises and fitted the operating room with equipment that make easier some surgical activities such as C-sections, a consulting table and surgical equipment. Besides, the ambulance makes it possible to reach the patients with no noticeable support in areas that are hard to reach. The ambulance also helps sensitize and carry back volunteer blood donors. Here, 7 to 8 maternal deaths were recorded each month before the arrival of the ambulance. For 6 months now, no maternal death has been recorded at Walungu General Hospital. But beside women's needs in terms of reproductive health, basic health care, and empowerment, there is the essential issue of good, fair judicial system capable of suing, judging, and punishing gender-based violence perpetrators in the Democratic Republic of Congo. With a surface area of 2,345,000 square kilometers and a population of 60 million inhabitants or more, the DRC has only 2,000 magistrates. Roughly speaking, it is thus easy to figure out that between the demand and supply of justice, the gap is impressive. At this very moment, for the first time in 15 years, a 2,000 magistrate recruiting operation has already been started. 1,000 of those 2,000 magistrates are already being trained in order to go on duty from July onwards. And the remaining 1,000 will be coming in from July 2011 onwards, which will add up to 4,000 magistrates. We thought that the presence of women had to be noticeable in this judicial staff and considered that it was an inevitable opportunity for the government. We recruited 400 women among the 2,000 magistrates, or nearly 40%. In Goma, capital of North Kivu, support to the women and girls victims of sexual violence is reinforced by UNFPA, with the contribution of the Canadian government for several civil society associations such as GESOM, a medical mutual help and solidarity group. Here again, the ambulance provided by UNFPA, still on Canadian funding, brings about significant change as to the support of vulnerable women. The ambulance arrives. It's bringing a 17-year-old girl from Kibumba, 15 miles from Goma. She was raped while she was quietly going back home After attending a soccer match, the monitoring house of Kibumba immediately referred her to GESOM, who sent the ambulance. She now joins the other 33 victims inpatients at GESOM Medical Center. In this type of management, in addition to the medication, we deal with traumatism-related rape, such as urinary fistula treatment. We also deal with uterine prolapses, either by repairing them or by carrying out a hysterectomy. In addition, in collaboration with our partners, we also deal with psychosocial support of the victims that we receive here, with our trained advisors working here in the medical center. 10 days after her arrival at GESOM Center, the young victim, very satisfied of her treatment, feels ready to go back home.
I was well received at the GESOM Center. I've got good medical care. Now I feel good and I want to go back home.
Still in Goma, the social reintegration of the vulnerable women goes together with the women empowerment effort initiated by the Ministry of Gender. Here, women who are cured of fistula or victims of violence are supervised within a soap-producing project by Caritas, with the support of UNFPA on Canadian funding. They have learned how to make soap to face their economic needs.
After the rape, I was recuperated by Caritas in the soap-making project, which helped me reach self-support. Now I can meet my own needs.
Not far away, at Ndoso Center, the women get comprehensive training in sewing and confection. But where Congolese women undergo all the trials and tribulation of life, some individuals almost all over the country stand up with one credo: improving the situation of the Congolese woman. In Bukavu, Aurélie Bitondo does not go unnoticed. She is the Secretary General of REFAM, African Women's Minister and Parliamentarians Network, DRC section. As REFAM leader, she fights for women to be represented in the decision-making bodies in the DRC. REFAM also advocates towards the Congolese authorities the consideration of health matters and all other issues that vulnerable populations have to face.
The present constitution of the Democratic Republic of Congo is one of the first ones to provide for men-women parity. For us, it's our first victory. We have devoted a whole national program to women's promotion in the democratic governance. That means that we want to support women, reinforce their capacities so that they join the democratic ways of taking part in the governance. As electors, they already have such power, 63%, but also as elected, eligible persons, they are to reach 50% parity.
Out of the 500 MPs that compose the National Assembly, 50 MPs or 10% are women. I can say that such a proportion is not the one we would like to have. We wanted to reach about 30% and then try to achieve 50%. But the Assembly is a democratic institution. It is the expression of the people's will, as one can become an MP only at the outcome of free elections. All we can do is to encourage the women so that they can have as many candidates as possible.
Our next action will be to enforce this provision of the Constitution through a law. We have worked with the Ministry of Gender, Family and Children. The law is now at the government's desk. We are waiting for it to be sent to the parliament in order to be adopted and finally promulgated by the President of the Republic. Because we don't want this provision to remain just constitutional, we want it to be a part of the weight of the law in our country.
In Kinshasa, the capital, Adel Kayinda is the president of the Gender Parity Network at the National Assembly. For her, this parliamentary experience is very enriching.
Nous sommes allés aux élections, c'était notre première expérience.
We took part in the elections. It was our first experience. I know that next time the women will fight again, but this time, for most of them, it was the first experience. As you see, at the National Assembly, the women don't often intervene, and we understand that it's their first experience, but within the networks, we're reinforcing capacities. Some of them are doing well, and I'm proud of them because now they stand up and voice their concern. So I'm proud of our women's parliamentarian performance because our objective is to convince the female voters, but also men and children, in order to have women elected because women have a symbiotic identity.
The efforts leading to a greater representation for the Congolese women at the National Assembly are in fact backed by a bill. But such a bill is considered as permissive by Mr. Evariste Boshab, President of the National Assembly. We would like that, as far as law is concerned, there would be no permissiveness as in the present law, where it is asked to the political parties to have women significantly represented among the candidates, but without determining the proportion and even without providing sanctions to go with the proposal. We would like, and we are working to such effect, that in the next elections, the lists in which women are not represented be considered null. The determination of REFAMP expressed by its leader Aurélie Bitondo and the progressive stance of Mr. Evariste Boshab are perfectly on the same wavelength as the new orientation that UNFPA sets for its mandate in the DRC. The present commitment of Women for a Better Congo is fully supported by UNFPA. I think that the time has come to stop drafting documents and to get in the field. So, in the phase which is starting now, we want to help the government and the key partner institutions at national level to carry out all those policies so that it will not remain a mere document in the drawers of the departmental headquarters. And the United Nations Population Fund now appears as a determined field-oriented agency closer to the beneficiary populations, and from 2010 onwards, our results will be appreciated with regard to the changes brought about to the beneficiary population and not to the number of documents that we have supported. The field, that is in fact UNFPA's prerogative. Here in Kasenga, 136 miles from Lubumbashi in Katanga, tens of girls victims of sexual violence, unwanted pregnancy, or early marriage are delighted at the construction and equipment of a women's house by UNFPA with the support of the Emergency Humanitarian Fund. Good example of empowerment for women in difficulty. Here, women learn how to use the sewing machine, manufacture products that they sell on the market. This is the second class of trainees. It comprises 100 unmarried mothers. The first class, that included 250 unmarried mothers and vulnerable women, has already left after completion of training and is now very active. One can feel the liveliness of the school, but there could be greater joy and results.
We're lacking means. That is why we're asking for help, because some of the girls are outside in the sun. We don't know where to put them. We turned down many of the girls who also wanted to join us. If we could have a big hut outside, it could also be used as a class, but how to get the means is our problem. Some of their babies are in the sun. We also need someone to help us look after the babies so that mothers have time to learn how to sew. You can see for yourself inside. With a baby on the back, what to do? Put the baby on the ground? He's crying and the mother needs to learn. What can she do?
Principalement la grande action.
The great action has been the creation of women's houses in all our provinces, because those are the places where they can go and learn about themselves, their rights, and know that they have rights and duties. There, they can learn trades such as sewing, catering, or computer science. That's why we're building those houses in our province with the help of international organizations. We have the big responsibility of settling those houses at all levels, all decentralized levels, because there is a whole range of activities to carry out in terms of training, sensitizing, apprenticeship, trade management, and even the gender approach.
Adrienne Binwana is head of the Women and Development National Service at the Ministry for Gender, Family and Child. Jointly with UNFPA, her service works on institutional capacity reinforcement, access to human resources, and the reinforcement of women's legal status.
The big problem is the means to give to women in order to develop their resourcefulness. Lately, on the occasion of the arrival of the UNFPA Executive Director, we organized an exhibition of women's products. The women are very resourceful, but the small means they have cannot improve their conditions.
We are in the Katanga, in Lubumbashi, commune of Katuba, where the Maendeleo Women's Association is in action. Under the supervision of the Gender, Family and Development section of the Provincial Ministry of Gender, these women are getting impressive results. Francine Sombo, a member of Maendeleo, has had her life changed by this field.
Since I began working here, I've been able to pay for my children's tuition. And I breed chicken, which helps me solve some household problems.
Not far away, in the heart of Lubumbashi, at the Unit for the Protection of Mother and Child, the Congolese woman finds another reassuring support. A police resolutely committed to restoring and protecting women's rights. This police, supported by UNFPA with the humanitarian urgency funds, is the very expression of the Congolese woman's confidence in the law at present. In fact, the Congolese law reacts against any form of violence against women.
The women of Congo, supported by men of goodwill, launched the Je Dénonce campaign. I denounce all forms of violence against women. They are all listed here, but I especially denounce sexual violence against women and children. It's this far-reaching campaign, Je Dénonce, that took to the street 150,000 women, regardless of obedience and social divide, that gave more momentum to the implementation of this strategy.
Formerly, the case of a man who gets drunk, goes home late and beats his wife for unconfessed reasons was called domestic squabble, but now it's called general law violation, which means that the offended woman can come to our office to complain. So we arrest the said man and sue him for willful assault and battery against a woman. Now in the DRC, the law and the police have done a lot to help women defend their rights. To the law, the notion of sexual violence has become more flexible. In fact, procuring, forced marriage, early marriage, partner abuse, and sexual harassment in working places are considered as violence. For example, when a woman says, I have found a job in a given enterprise, but my husband doesn't want to let me go to work, we see with the employer. If the woman has the profile for the job, we guarantee the right for the woman to apply and be hired. The joint efforts of many departments of the DRC government do converge towards women's welfare, social reintegration and empowerment. But the work would be incomplete unless an effort is made to promote justice and fight against the impunity of the perpetrators at all levels.
Nous avons un officier général de l'armée.
An army general has been arrested and sent to the central prison of Makala for alleged rape on underage girl, which is sexual violence. With that army general, there are some senior officers. There are 4, 5 or 6 of them. And there are other trials, and the military court has pronounced several sanctions on sexual violence. The efforts of the Ministry of Justice may seem insufficient as regards the search for solutions. We need help at international level, capacity reinforcement, a support drive to the government action, and Congolese justice. However, as regards quality, the Ministry of Justice has carried out many arrests and trials of violence perpetrators. In the meantime, in Mbandaka, lawyer Lambert, head of the SDIP Legal Clinic, is proud of the democratic progress made in his country, mainly as regards his victory against the state in a trial during which he courageously defended the case of women victims of rape. A little reminder, in 2005, in Mbandaka, on the 3rd and 4th of July, members of the army of the Bokala barracks rebelled. They attacked 2 districts of Mbandaka, namely Bongonzo and Mbandaka 2, and during their adventure, they sexually abused 64 women, and 54 of those women decided to go to court and complain against the soldiers that sexually abused them. We helped them, they won the case, and the Congolese state, which is civilly liable, was condemned. But the fight goes on for lawyer Lambert Lissika and his clients. We want the state to set an example by executing its own decisions. Here again, the partners contributed together to the results. UNFPA helped us collect the data. We had inquirers who collected the data and sensitized possible victims of violence. But the Congolese government has not been left out.
The government has put in place a whole agency, the first one of the kind, the National Agency for the Fight Against Gender-Based Violence, that supports the national strategy. Our country has got access to the United Nations Convention on the Elimination of All Forms of Discriminations against Women for over 25 years, but this is the first time that we have a state structure for carrying out the elimination of discriminations. Among the women themselves, the government can find the synergy that can be developed with bi- and multilateral support, jointly with women's and civil society organizations.
Among those women are the members of the influential Cadre Permanent de Concertation de la Femme Congolaise, Congolese Women's Permanent Framework for Concerted Action, CAFCO, whose main mission is to see to it that the gender perspective is respected in all the policies established in the Democratic Republic of Congo. CAFCO is a platform of different women's organizations networks.
Our mission also consists in training the women and popularizing their rights, which is very important, as people have to know their rights in order to defend themselves. We have to popularize the laws and suggest to the legislators some laws favorable to women.
Despite the well-known results of its actions, CAFCO very often finds it hard to get means.
We don't have the means for our policy, but we use the means at our disposal and get the message across. It's a whole process, but we think that if we keep on working as we're doing now, we'll get good results. At present, one of our most lasting strategies is the spreading of local councils to each street, each district or town, so that the grassroots woman does not appear as a vulnerable person that can be exploited in various ways, but appears organized, structured, standing up as part of her own right, in all stakes at country level.
Hardened Congolese women concerned about taking part in the development of their country. Hard-working Congolese women who are willful and well-trained. Those are the trump cards of the present Democratic Republic of Congo as it celebrates its 50 years of independence. But in order to play fully their role within the society, today's Congolese women need to be freed from the constraints of tradition and the hell of insecurity and sexual violence, which calls for absolutely necessary participation from a well-sensitized international community.
Our country does not produce weapons, and it is under embargo, but what is happening is horrible. So long as the international community is not sternly sensitized so that the war which is rife in DRC stops, there will always be very high rates of sexual violence, mother and child mortality, because the infrastructure will always be destroyed in such a way that no good results can be expected. The international community has to be sensitized, mobilized, so that peace may be restored in DRC.
Nous pensons que sans
We think that without the help of the international community, we will never be able to improve the present healthcare management by reducing the maternal and child mortality that keeps aggravating the situation of health in our country. Harmony with UNFPA that goes even further. We don't have the right, as an agency in the United Nations system, to say that because this state is fragile, we haven't been able to reinforce the capacities. Within 5-10 years, the impact of capacity reinforcement will be essential for the shaping of the future of this country. So, we wouldn't use the fragility of the state as a pretext for doing nothing. Stand-partism as regards capacity reinforcement is just blamable.